This is the patient assessment medical skill. Today, our scenario is going to be a 57-year-old female who called 911 because she has chest pain. First, I want to make sure that I have my BSI on, my safety glasses and my gloves, and that the scene is safe. Next, because of the call, I'm going to assume this is a nature of illness. I appear to have one patient. Because of the nature of illness, I'm going to call for ALS backup and I'm going to consider C-spine precautions. I'm going to approach the patient and I'm going to get initial impression. I see a adult female sitting up holding her chest. At this point, I'm going to make her a stable patient. I'm going to determine if there are any life threats. I don't see any obvious life threats anywhere. Ma'am, my name is John. I'm an EMT. I'm here to help you. What's your name?
Judy.
Judy, and how old are you, Judy?
57.
57 years old. Do you know where you are right now, Judy?
San Diego.
And do you know what day of the week it is?
Tuesday.
Okay. Did you raise your right hand for me? Great, thank you. Put it back down again. At this time, Judy appears to be ANO times 3, person, place, and time. On the Glasgow Coma scale, her eyes are open. That's a 4. She's fully oriented, which is a 5. She follows commands, which is a 6. To a total of 15 points. Judy, why did you call us today?
I have chest pain.
You have chest pain. Checking her airway at this time. She's talking in full sentences. I don't hear any gurgling or need for suctioning. I'm also checking the quality of her breathing. She seems to have good tidal volume, rate, and effort. So I'm considered to be adequate at this time. I'm going to apply 15 liters via non-rebreather mask. Place it over. Breathe in, that's fine. And I'm going to make sure that she has good effort and rate with that oxygen that I just gave her. Next, I'm going to check circulation. Because she's an awake, alert medical patient, I'm going to check for a radial pulse. And I appear to have a strong, slightly irregular radial pulse at a fairly normal rate. I'm also looking for any uncontrolled bleeding. And I'm going to check circulation. Skins appear to be pale, moist, and a little warm. Based on the patient's presentation and her chief complaint, I'm going to make her an unstable patient and transport her to the hospital as soon as I can. First, I'm going to try to obtain a history of the event. Ma'am, what were you doing when this started?
I was in the kitchen.
In the kitchen, and did the discomfort come on fast or slow?
Fast.
Okay. Does anything make the discomfort better or worse?
It's the same.
Same all the way through? Okay. And I know you were holding your chest right here, but can you tell me what it feels like, what that discomfort feels like?
It's heavy.
It's a heaviness in your chest? Okay.
Yes.
And it's right where your hand is, right here on your chest. Does it radiate anywhere or move anywhere?
Yes. It goes down my arm and in my jaw.
Arm and in your jaw. And does it stay steady or does it move or does it come and go?
It's steady.
Stays steady. And can you, on a scale of 1 to 10, can you describe how much the pain hurts, from 1 being the least, 10 being the most?
About a 7.
About a 7. And how long has this been going on for?
20 minutes.
20 minutes. And during the onset or at any time, did you get dizzy?
No.
Did you get sweaty at all?
Yes.
And are you short of breath at all with this?
Yes.
You are short of breath with this. Okay. Do you have any allergies to medications?
No.
Do you have any medical history that we should be aware of?
I had a heart attack last year.
Do you take any medications at all now?
Yes. Lotensin.
Lotensin, okay. You want anything else?
I take aspirin.
Aspirin, anything else beside that? You take any nitroglycerin?
Yes.
You do take nitroglycerin, okay.
Yes.
Did you take any of your nitroglycerin before I got here today?
No.
You didn't, okay. When was the last thing you ate or drank?
I had toast and tea.
Okay. And the event today, when your discomfort came on, could you associate that discomfort with any recent fall or trauma?
No.
Have you had a cold or flu at all? So totally unrelated to any other onset, just came on suddenly by itself. Okay, well, with your permission, I'd like to inspect the area that you're complaining of. So what I'm going to do is I'm going to expose your area of your chest. I'm looking for any scars from previous surgeries, implantable devices, any signs of trauma. I don't see anything. I'm going to get lung sounds, listening anteriorly and posteriorly. They appear to be clear at this time. And take a deep breath for me, ma'am. In and out. Does that make your pain any better or worse?
No.
No, it does not. Okay. So at this time, secondary appears to be negative. I'm getting a full set of vital signs. Her blood pressure is going to be 160/90. Her pulse is still strong and irregular at 72. She's breathing at 20 times a minute with clear lung sounds. Appears to still be full and effective. Skins remain pale, warm, and moist. At this point, I'm going to do my field impression of the patient is an adult female with a complaint of chest pain. Because of her history and the medications that she's on, I'm going to consider her to be a potential cardiac patient. I'm going to treat her as such. Ma'am, can I see your medication, your nitroglycerin? Okay. I'm looking at a nitroglycerin bottle. I'm going to do the 5 rights. It is nitroglycerin. It is 0.4 milligrams per tablet. This is delivered sublingually. It's not expired and it appears to be her own medication. Ma'am, have you taken any erectile dysfunction drugs in the last 48 hours? Any Viagra, Cialis, or Levitra?
No.
And I understand that you're on a hypertension medication, but are you treated for pulmonary hypertension?
No.
No, okay, so you've never taken anything called Flolan, Litri, or
No.
Rebatio?
No.
Okay, great. And you haven't fallen down, hit your head recently?
No.
You're not bleeding into your
No.
cranium? Okay. Well, her blood pressure is above 90 systolic. Her heart rate is between 150 and 100. And based on medical direction and standing order, I can deliver up to 3 doses of nitroglycerin sublingually as long as her blood pressure remains above 90 systolic. And that includes her own medication that she took herself, but she didn't take any today. So, ma'am, what I'm going to do is I'm going to take 1 tablet, I'm going to place it in this cup, and I'm going to have you put it under your tongue, and don't swallow it, and don't chew it. Okay, great. At this point, we're going to be transporting the patient to the hospital, and on the way to the hospital, I'm going to reassess the patient every 5 minutes. I'm going to reassess my primary assessment, which includes the level of consciousness, ABCs, and I'm going to reensure that oxygenation remains flowing, and she's getting good tidal volume with that O2 that I gave her. I'm going to reassess vital signs at least every 5 minutes and after every dose of nitroglycerin. And I'm going to redo my secondary, focusing on her chief complaint. So I'm going to ask her, ma'am, I know your pain was a 7 earlier. I gave you that dose of nitroglycerin. What's your pain like now? Can you rate it now?
It's about a 3.
So it's gotten better. It's about a 3. Okay. And I was continue reassessing the patient all the way to the hospital. When I got to the hospital, I would give a turnover to the doctor or nurse of record. I would state, sir, ma'am, this is Judy. She's 7 years old. She was standing in her kitchen today, started having a sudden onset of left anterior heaviness in her chest. It was a 7 out of 10 scale initially, radiating to her shoulder and her jaw. A patient said that she got sweaty and also dizzy, sweaty and short of breath when it started. Patient has a history of hypertension, had a heart attack 1 year ago. She's on low tension, nitroglycerin, and aspirin, has no allergies to medications. Vital signs have remained stable throughout the call. I've given her 1 nitroglycerin tablet sublingually. It's dropped her pain from a 7 to a 3, and she says she's feeling much better at this time. Do you need anything else right now?